Hello and welcome to Module 2, Lesson 3, The Role of the Paraprofessional. This is the third lesson in Module 2 of the Integrated Care for Behavioral Health Paraprofessionals course, which has been developed by the Grow Our Behavioral Health Workforce program of the Center for Health Innovation. The purpose of this module is to explore the multifaceted roles and responsibilities of the behavioral health paraprofessional on the integrated care team. Lesson objectives. Students who successfully complete this lesson will be able to describe the role of the behavioral health paraprofessional in the integrated care team, explain how the paraprofessional works within the integrated care team, and demonstrate the concept that the paraprofessional works with, not for, the client. Keywords: ambiguity, boundaries, dual relationships, facilitate, and navigate. Lesson outline. We'll begin by talking about why integrate paraprofessionals into the integrated care team. Then we'll shift to the roles and responsibilities of the paraprofessional on the team and challenges to integrating paraprofessionals into care teams. Finally, we'll pause to discuss the concept of doing with, not for, that guides the paraprofessional on the care team and in relationship with the client. We'll recap everything with the lesson summary, look at the references, and then finally, don't forget to check your understanding in the quiz, the self-assessment quiz at the end of the course. You may take the quiz as many times as you wish. However, you must pass with an 80% or better to move on to the next module. Why integrate paraprofessionals into the integrated care team? Community health workers and other behavioral health paraprofessionals often work with people that health systems have historically struggled to engage. When integrated into teams, they allow the health system to reach those people, build trust, and support patients' ability to make choices and navigate the system in a way that meets their needs with respect. Paraprofessionals help patients navigate a broad range of health and social needs. They act as patients' allies, doing with rather than for the patient. This allows them to build and maintain trust with patients and can help to facilitate the patient's trust in the entire team. Paraprofessionals help all team members to work effectively and efficiently. The person who needs care is at the center of the team, owning the journey and the results. The skilled paraprofessional walks beside the patient on their journey, allowing the patient to choose their own route to wellness, but being an ever-present supportive friend along the way. What are the roles and responsibilities of paraprofessionals on integrated care teams? Paraprofessionals include peer support workers, community health workers, comprehensive community support workers, and others. Just so you know, when I refer to paraprofessionals, I want to emphasize the broadness of the issue. Pretty much anybody who acts as a liaison between the patient and the health system. They play really key roles in the integrated healthcare workplace, serving as a bridge between patients and other care team members, helping to facilitate communication and care. Each type of paraprofessional has a different set of skills and competencies, scope of work, and assigned duties. However, there are ways in which their duties overlap in the integrated care setting. First of all, paraprofessionals create connections. Traditionally, community health workers have functioned as the liaison between individuals and systems designed to provide health care and social services. Other paraprofessionals, as they have stepped into multiple roles, similarly are functioning in that liaison role. Even for people who have achieved patient status, navigation of these systems can be complex, time-consuming, and very confusing. So community health workers and other paraprofessionals can help to create that needed connection. They help the patient navigate. Paraprofessionals help people navigate systems, that is, plan and follow a path through the complex tasks involved in getting the care and services they need. This may include providing assistance with enrollment, appointments, referrals, transportation to and from appointments, and interpreter services at appointments. Ultimately, the goal of the paraprofessional is to teach people how to navigate these systems themselves. They assist healthcare professionals to understand the patient's individual, familial, community, and cultural needs. Because paraprofessionals generally come from the communities where they work, and they may share lived experiences with their patients, they're in a unique position to actually provide information to other care team members. They understand the processes and difficulties associated with recovery from or management of substance use disorders or mental illness, and they can help healthcare professionals to understand the cultural and experiential context of their patients' lives. Conversely, they can help patients understand that there is a path forward and that others have traveled that path. Paraprofessionals support individuals' goal-setting, implementation of self-management plans, and long-term self-management support. They act as the facilitator or the enabler of the patient's plan. They work with the patient to enact the plan that has been developed with primary care and behavioral health clinicians. And this facilitation may range from helping the patient to learn how to purchase fruits and vegetables cheaply on a limited budget, to using an app to track their mood, to reaffirming goals after a relapse. They help patients prepare for appointments with clinicians. They help them think through concerns before appointments and help them decide and learn how to convey those concerns to the clinician. They accompany patients to appointments. At the patient's request, the paraprofessional may accompany the patient to appointments to provide support, take notes, and help assure they understand instructions. They collect data. They play a really important role in documenting patient encounters in the electronic health record, collecting data in the field, and helping other team members to track patient progress. Finally, they provide community education and advocacy. They may extend their roles into the community as opposed to simply working one-on-one with individual patients, providing classes, education, advocacy, and more. In one study, researchers found that community health workers and their program directors strongly felt that CHWs should spend time in the community in line with the origins of the profession rather than being limited to office work. So with all of that magic that you paraprofessionals do, what are some of the challenges to integrating paraprofessionals into care teams? Here's the positive part, which is that the role of paraprofessionals is increasingly recognized as key to the success of integrated care teams. But those challenges remain to integrating them into the workflow and process of integrated care, partly because sometimes you don't even work in the clinic. Key challenges include lack of communication, ambiguity, sharing of personal information, privacy and confidentiality, and boundaries in dual relationships. Let's take a look at each of those. Lack of communication. Communication among team members is the base of integrating care. We've talked a lot about communication and skills, but what does that look like? When the team does not have good communication protocols, you cannot have patient-centered work. Clear communication is necessary for paraprofessionals and their supervisors to define roles clearly and assure that the work of paraprofessionals complements that of other team members. Ambiguity. Lack of clear understanding of paraprofessionals' roles as part of the health team can lead to ambiguity or not knowing, leaving you kind of in the middle. Some research refers to paraprofessionals as adjuncts to the team, while other research insists that paraprofessionals are integral parts of the teams they serve on. So, you know where I fall in that one, but Clinicians and other healthcare workers might not be familiar with the skills, competencies, and scope of work of paraprofessionals. In each paraprofessional, each type of paraprofessional has a different scope of work. So this can be really hard. It's not their fault. You need to educate your coworkers as well as the patients you work with. Sharing of personal information. Shared lived experience is key to successful paraprofessional support. Paraprofessionals may need to share their own personal information with coworkers. This can be awkward and requires discretion in the context of personal relationships. Both clinicians and support workers must maintain clinical boundaries. To maintain boundaries, focus on the reason you are on this team, which is to help a particular patient achieve their goals. Privacy and confidentiality. Paraprofessionals learn about sensitive parts of clients' lives, including details about mental illness, substance abuse, criminal activity, HIV status, and sexual orientation. Paraprofessionals must manage clients' private and confidential information carefully, sharing only with appropriate team members when needed and with the client's approval. They also need to know when it's important to disclose information. That is, when there is a threat of imminent, serious, and foreseeable harm to the patient or others. Boundaries and dual relationships. Paraprofessionals may encounter difficulty with boundaries and dual relationships in the workplace, especially in small and rural communities. Boundaries establish how all parties want to be treated and what you can expect from each other. Boundaries are important in all aspects of our lives, but especially in such a sensitive workplace environment. Dual relationships can occur if the paraprofessional was once a client of the agency that hires them. They may become colleagues of their former service providers. Clear boundaries can facilitate, that is, make it easier or help bring about, the shift from the status of client to the status of former client and colleague. Finally, let's talk a little bit about doing with, not for, as an underlying philosophy. The key tenet of the paraprofessional's work is that they do with, not for, the client. The client is empowered when they learn how to navigate systems themselves. We don't empower people. People empower themselves through learning, education, and hard work. Let's take a moment and look at a hypothetical case of someone we'll call Isabel. Isabel is a 22-year-old mother. She is struggling with depression since after the birth of her son Roberto about 6 months ago. She developed gestational diabetes pre-eclampsia during her pregnancy, and the diabetes has remained postpartum. She works part-time, partly because she does not have enough money to pay for child care, so she can only work time when her mother's watching her. She's required to leave the apartment at the end of the month. She fears that she will need to quit her job to care for Roberto, and she's having difficulty finding affordable housing. Her A1C level was extremely high, 12 at her last primary care visit, and she says she is not motivated to do anything. So you are the community support worker assigned to her case. The team includes a primary care physician, advanced practice nurse practitioner, licensed social worker, and a psychiatrist who has prescribed antidepressant medication. Isabel is also receiving services from a lactation specialist and home visiting program, both of which are affiliated with the local hospital. So Isabel has a pretty strong team. She's got her core team, right? Primary care physician, practitioner, clinical social worker, and psychiatrist. And she also has that extended service from the home visiting program and licensed. So she's got some support, she's got some things, but you're kind of worried about her. So Isabel tells you she's been eating lots of donuts and cake. Not a great thing for somebody with diabetes, right? To help herself deal with stress she's under right now. So how do you respond? You respond first by acknowledging that it's a reasonable response to a frightening set of circumstances. You can point out that it's not making things better, only harder for her to deal with in the long run. It's probably just worsening the diabetes, increasing her risk of having an acute diabetic episode, and she's probably gaining some weight, and that sugary stuff isn't giving her anything to enhance her mood. And you help her to make an appointment clinic. So note that you're doing with her, sitting with her, acknowledging where she's at. You're not going to chastise and tell her to stop eating those donuts. And you're not going to make that appointment for her, but you're going to be doing it with her. So next time, hopefully she'll know how to call herself. So the other thing that you know is she's housing unstable. So you help her navigate the online application for child care subsidy for low-income families. She didn't know it was available. You can let her know that it's available. And you know that the application is complicated. You sit with her while she fills it out, and you make sure that she's got all of the materials and information she needs. You help her to call the local housing authority and set up an appointment. She asks you to accompany her to the appointment, and you agree. Then, when you're done, you record your plan in the electronic health record with a note to both the licensed clinical social worker and primary care provider. So everybody is in the loop, and you've specifically alerted those two. So right now, you could have just gone, I'm going to fill these forms out for Isabel. But Isabel, you've sat with her to help her do them herself. This is what we mean by the concept of doing with, not for. Okay, time for a recap. Lesson summary. Why integrate paraprofessionals on the integrated care team? Community health workers and other behavioral paraprofessionals often work with people that health systems have historically struggled to engage. When integrated into teams, they allow the health system to reach these people, build trust, and support patients' ability to make choices and navigate the system in a way that meets their needs with respect. Paraprofessionals help patients navigate a broad range of health and social needs. They act as patients' allies, doing with rather than for the patient. This allows them to build and maintain trust with patients. As members of the care team, they can help facilitate trust in the entire team. The roles and responsibilities of the paraprofessional on the integrated care team include serving as a bridge between patients and other care team members, helping to facilitate communication and care. Each type of paraprofessional has a different set of skills and competencies, scope of work, and assigned duties. Those duties often overlap in the integrated. Their key roles and responsibilities include creating connections between people in healthcare and social services systems, help the patient navigate healthcare and social services systems, and assist healthcare professionals to understand the patient's individual, familial, community, and cultural needs. They support individuals' goal setting, implementation of self-management plans, and long-term self-management support. Help patients prepare for appointments with clinicians, sometimes accompany patients to appointments, collect data, and provide community education and advocacy. Some of the challenges to integrating paraprofessionals include lack of communication on teams, ambiguity about their role, sharing of personal information, privacy and confidentiality, especially if the paraprofessional has once been a client, and boundaries and dual relationships. Paraprofessionals do with, not for the client. The client is empowered when they learn how to navigate systems themselves. References for this lesson include the following. And don't forget to check your understanding with the self-assessment quiz. Have fun, and thank you so much. This has been Module 2, Lesson 3 of the Integrated Care for Behavioral Health Paraprofessionals curriculum. This program has been developed by the Grow Our Behavioral Health Workforce Program of the Center for Health Innovation with funding from the Health Resources and Services Administration.